Good evening, ladies and gentlemen. My name is Shireen, and on behalf of ART Fertility Clinics, I welcome you all to this webinar. ART Fertility Clinics, a leading global institution in reproductive medicine, follows the doctrine of evidence-based medicine and provides personalized treatment plans for all its patients. These plans are personalized on the basis of its proprietary research, which takes into account the patient's ethnicity, social and cultural mores, and previous medical history. This holistic approach of combining science, nature, and geographical factors has enabled ART Fertility Clinics to achieve the highest successful pregnancy rates globally of 69%. ART Fertility Clinics aims to transform the IVF technology sector in India by implementing the most stringent IVF protocols in accordance with ESHRE across all its centers. Since the birth of the first IVF baby, Louise Brown, the world has seen significant advancements in reproductive medicine. This has led to the birth of more than 9 million babies globally through IVF, and the number is growing each passing day. Today, we have with us Dr. Gurpreet Singh Kalra, Medical Director Designate of ART Fertility Clinics India, and the world's first IVF baby, Ms. Louise Brown. Let me now welcome Dr. Gurpreet Singh Kalra, our Medical Director Designate for ART Fertility Clinics India, to share his thoughts on the topic, the evolution of assisted conception treatments, Louise Brown and since, a historical and scientific perspective. Now, before we start, let me just share a bit about him. Dr. Kalra will be joining ART Fertility Clinic India as Medical Director from August 2021. Over an illustrious career of 30 years, Dr. Kalra has worked as a clinical director and consultant reproductive medicine and surgery at the Wales Fertility Institute, NHS UK. He also holds a specialist registration as consultant in UK, Norway, and Sweden. He also contributes as honorary academic lecturer at Bristol Medical School, University of Bristol. He is a member of the Q Community, a platform for quality improvement in the NHS, and a fellow of Faculty of Medicine, Leadership and Management in the UK. Dr. Kalra has developed his career in women's health and reproductive medicine and surgery over the last 30 years, working in Europe and the UK. A visionary and a strategic clinical leader with commitment to patient safety, quality, and outcome improvement in healthcare, he is also a passionate medical engagement expert with excellent communication skills to interpret patients' and clinicians' needs. Over to you, Dr. Gurpreet.
Thank you very much, Shireen. That's a very kind introduction. Ladies and gentlemen, it's my privilege to be here today with you. It's the time we're marking and celebrating birth anniversary of the world's first successful IVF treatment child. She's with us today, Louise Brown, and we'll have spend some time with us later on. My intention today is to, let me just share my screen. Here we are. Right, so given the that we're celebrating the success of IVF treatments and marking that ART Fertility Clinics, I found that there was no more befitting topic to talk about than evolution of assisted conception treatments. My intention is, or objective is to talk about how the things developed between Patrick Steptoe and Bob Edwards. Their collaboration progressed through trials and tribulations, failures and successes, leading to the final success, and how things have changed since IVF has developed after birth of Louise Brown till now, and what interventions have made significant difference. Now, time being limited, I'll try to do my best to go through the time before and after birth of Louise Brown, and hope I make it interesting, a historical and scientific perspective for you all. So, starting with introducing you to the winning team here. The top left corner, we've got Sir Robert Edwards, Bob Edwards, with his Nobel Prize medal at the back. On the right top corner, we have Patrick Steptoe, Dr. Steptoe, the gynecologist and the laparoscopist. And on the lower left corner, not to forget, Jean Purdy, unfortunately often gets forgotten. She played an extremely important role in the team, no less than the others. She was the nurse, the embryologist, and the quality manager. And in the right lower corner, you're seeing a very happy Patrick Steptoe and Bob Edwards. Patrick holding Louise Brown on the day of her birth. And you can imagine their happiness and their jubilation. And in the middle is the midwife who assisted Patrick Steptoe on the day. Now, I call this description of what happened as the beginnings, but you can easily call it the musings, their reflections, their trials and tribulations, and it's a reflection of the resilience, the tenacity, the perseverance, the purpose, and the more than anything else, the passion Patrick Steptoe and Bob Edwards had to keep going through their repeated experimenting, their repeated testing, repeated failures and successes, and finding eventually the success. Now, I must declare here that the account I'm going to go through has been written by Bob Edwards himself, and I'll refer to the text after my first 3 slides. So going back in those times towards the later end of 1960s, Bob was working at Cambridge University. He had been experimenting on pigs, oocytes, hamsters, rabbits, studying the development of growing of oocytes and fertilization, etc. And he was constantly looking for human oocytes to study and experiment on to continue his research. And that was difficult to come by. And at the time, he managed to find a clinic in Baltimore in the United States who were doing veg resections for polycystic ovarian syndrome, and he could get access to that tissue. So he traveled to the United States and spent some time there to be able to get these access to the tissue and continue his research on human oocytes. While there, he got his eye on a publication by Patrick Steptoe in Lancet in 1968 called Laparoscopy and Ovulation. And he immediately called Patrick Steptoe asking for collaboration, because that in his mind just clicked, because that was the missing link, the missing piece of jigsaw to help him get access to human oocytes and together move towards the success of IVF. So Patrick Steptoe at the time was working in Oldham General Hospital as a consultant gynecologist and a laparoscopist. Bob Edwards made his journey back to Cambridge and then started commuting up and down from Cambridge to Oldham, which is about plus 200 miles journey. And Jean Purdy, at the time associated with Bob Edwards, set up his lab in Kershaw's Hospital in Manchester. Interestingly, at the same time, Piero Donini of Serono Labs had successfully purified urinary HMG to stimulate follicles. And that led to the start of first ovarian stimulation protocol, which Bob Edwards and Patrick Steptoe started when they started stimulating people to get more oocytes. The first protocol included giving 150 to 225 units of HMG on day 3 and 5, followed by 5 to 7,000 units of HCG, human chorionic gonadotropin. They started first collecting eggs after, and remember that this was initially a laparoscopic procedure to collect eggs, which Patrick Steptoe was doing. And they started collecting eggs after 28 hours based on the previous study of animal models. And they found all eggs to be metaphase 1, which was no good for fertilization. And then they delayed it till 36 hours because they'd seen laparoscopically that eggs would release mostly at 37 hours. So they started collecting eggs at 36 hours, and to their joy, these oocytes were metaphase 2 with the lovely viscous cumulus cells. And they then started inseminating these cells. They could get 5 to 6 mature oocytes from each ovarian stimulation cycle. They started inseminating them and successfully managed to achieve fertilization. They could see the 2 pronuclei along with tails of the sperms on the eggs, which indicated that fertilization had happened. With time, then, the collaboration continued. Better and better culture media were available, more complex media with HAMS F10, with more added albumin. And they started seeing sustained cleavage, which gradually moved on to become these embryos moved on to become morally and day 3, and then when they could start seeing lovely light translucent blastocysts. And it was fascinating to see that happening, and they could even see hatching blastocysts. And they kept on growing it. And there was no regulation at the time, and HFEA, one of the most stringent, most strict regulators in the world, does not allow growing the embryos anymore beyond day 6 now. But they could grow them to day 9, and that's the time when this was consistently happening, that they were growing blastocysts. They decided the time had come to replace them in the womb. At the time, Bob Edwards had a dream of starting pre-implantation, or being able to conduct pre-implantation genetic diagnosis on these embryos, because in rabbit embryos, he'd seen sex chromatin and male Y bodies. And he felt that if he could see that in human embryos, that could be the start of X-linked or sex-linked genetically transferred conditions. To his dismay, unfortunately, human embryos do not exhibit sex chromatin and male Y body to a degree that it can be diagnosed. Therefore, that dream had to wait. They were at the same time facing a lot of opposition. And as you can imagine, this was something against all culture, all faith, all religion, and all religious leaders were against their endeavor. The bishops in England, the Pope in Italy, and Vatican was against it. And in fact, some of the scientists, some of the leading names in science were against them, starting with James Watson, a guy of his stature, the guy who discovered the structure of DNA as double helix, along with Francis Crick. He was opposed to it, and also Max Perutz, who discovered the structure of myoglobin and hemoglobin. And these two guys vociferously opposed it. And they even took the fight to Senate in the United States to influence British government to stop their funding. However, as I said earlier, this is a story of tenacity and resilience and their faith in IVF. So Patrick Steptoe and Bob Edwards pressed on and pressed ahead, and they started and they continued transferring embryos transcervical. Now, as a scientist does, they kept on studying what is happening, experimenting, checking level of hormones, and the success was not forthcoming. And they discovered that the luteal phase is probably short. And they identified, as we all know now, that luteal phase in stimulated cycles is defective, it is short, and therefore implantation window is short. And they recognized the need for luteal phase support. They, at that time, started giving patients Primolute injections every 5 days. They couldn't, unfortunately, see any success in pregnancies for 3 years after that. And that's when they realized, again, through experimenting and several, PDSA cycles, they repeatedly found out that they were probably giving too much progesterone. And then they reduced the doses, and they had their first successful pregnancy in a stimulated cycle, which was unfortunately an ectopic pregnancy, and that had to be removed at 10 gestational weeks. They tried several different protocols, including gamete intrafallopian transfer, without seeing success. And that's when they started moving towards natural cycle IVF. And in order to identify at the time of LH surge, they started testing urine of these patients. They never had any dearth of patients. And as you can imagine, how the state of mind of our fertility patients tends to be, they will do anything. So they had a good flow of patients. So they started testing LH in the urine every 3 hours, and they managed to identify when the LH surge was starting. And then they found when they could transfer, when the window of implantation potentially could be. And they started transferring the embryos according to that. Leslie and John Brown, Louise's parents, were their second natural cycle IVF couple. Leslie had tubal factor subfertility, and they transferred a day 3 embryo, the embryo that was destined to become lovely Louise Joy Brown. It was a day 3 8-cell embryo. They transferred, and this is how success looked like. On 25th July 1978, Patrick Steptoe did an elective cesarean section on Leslie to deliver Louise Joy Brown, who was just under 3 kilograms or 5 pounds 12 ounces, at Oldham General Hospital in Manchester, United Kingdom. And you can see the image, first little Louise with the parents, and then Louise herself with her own 2 young boys and family. An amazing picture there. So that was the culmination of the hard work of Patrick Steptoe and Bob Edwards, and the story of IVF will not be complete without me mentioning success of IVF in India. The first official IVF baby in India was baby Harsha, born on 6th August 1986 in Mumbai, a collaboration between Dr. T.C. Anand Kumar, a reproductive biologist who later on became the director of National Institute of Research in Reproductive Health, a part of current ICMR. And this collaboration was with Dr. Indira Hinduja, a gynecologist in Mumbai. There is a twist to the story here. There's an unofficial claim that the first IVF baby actually in India was baby Durga, born on 3rd October 1978 in Hazaribagh in today's Jharkhand. A story of hard work of a remarkable scientist, Dr. Subhas Mukhopadhyay, who worked with the cryobiologist Sunit Mukherjee and gynecologist Dr. Saroj Kanti Bhattacharya. Now, it is controversial because it never became official. However, I must say here I was surprised when I was reading the recent document of ART bill, which is in Parliament, in Indian Parliament for approval. It mentions actually baby Durga as the first IVF child. And if that is true, can you imagine the enormity and the significance of this event, because this was just 2 months after Louise Brown's birth. And it will make India the country to claim the second successful IVF treatment in the world. Not only that, mind you, this was a frozen embryo transfer. So baby Durga, if the story is true, was the world's first FET success and from a stimulated cycle. I'll move on a little bit on to what subsequently changed and influenced IVF to become the successful treatment it is today and the safe treatment it is today. And I'll talk about a few things because of limitation of time, starting with controlled ovarian stimulation protocols that developed over time to become more and more effective and more safe for the patients. I've referred here to Cochrane reviews in the references. There is evidence that if the controlled ovarian stimulation protocols are individualized to patients, they give better success rate. And there is also, so we can look at the development of agonist protocols along GnRH agonist protocols initially, which reduced the risk of premature ovulation from 20% in these cycles to less than 1%. And also introduction of antagonist protocols, which led to reduced risk of ovarian hyperstimulation syndrome, making IVF treatments much more safe as they are today. And we know that antagonist and agonists, long protocols, have not noted significant difference between the success rates. So antagonist protocol has really caught up and is the protocol of choice. There is also a development in luteal phase support, and there is more and more move towards individualized luteal phase support. And I've referred here to a paper from our own group medical director, Professor Fatemi, from as early as 2007, where he's written this about luteal phase support. And I know that he's done a lot of work, and his team has done a lot of work on individualization of luteal phase support. And that research is the proprietary research of ART Fertility Clinics. Moving on to cryopreservation, that has changed the scene as well, with our ability to freeze excessive embryos and then do repeated frozen embryo transfers instead of having to start a fresh cycle. That makes IVF treatments less aggressive, more acceptable, and less invasive, and safer. And then genetic testing is catching up. There is evidence that genetic testing works in select group of patients and is probably going to be a regular part of IVF treatments in the near future. It's really already a part of the mainstay of treatments, not really an experimental treatment anymore. In the UK, for example, the overall outcome of these improvements have been that for under 35 years of age, the live birth rate per embryo transferred in 1991 from being at 9% has moved to 32% in 2019, based on HFEA trends and figures from 2019 data. Now, that's a remarkable improvement, although taking 28 years, we've come a long way since early days of IVF. ICSI was a step change for male factor subfertility. The first child born as a result of ICSI was in 1992, a work of Gian Piero Palermo and Paul Devroy from the Universiteit Brussels or University of Brussels. More recently, there has been some development in the form of physiological ICSI using HARP-selected sperms, as well as intracytoplasmic morphologically selected sperm injection. However, the evidence, as I've referred to in a Cochrane review in the references, is not very strong to support those treatments. Cryopreservation, as I said, has changed the scene. The first successful frozen embryo transfer birth was in 1984. It was a slow freezing technique, but if you go back to if the first IVF treatment in India of birth of baby Durga is recognized, then perhaps one can say potentially that was the first successful FET, 1978 itself. The newer vitrification method for oocyte and embryos involved more rapid cooling. And then subsequently, there was success from frozen oocytes and frozen sperms, very few sperms and single sperms. And lately, we have seen the development of ovarian tissue cryopreservation and transplantation, which is a remarkable event for us to be able to help young girls, pre-puberty girls, to preserve their fertility when they haven't even started developing follicles. We can now take out ovarian tissue and preserve it. And if they happen to be in an unfortunate situation and a malignant condition or a situation that is going to damage their fertility, we can now offer that treatment to our young population there. Now, the first live birth from ovarian tissue transplantation occurred in 2004, led by a team of Jacques Tenet in Brussels, in Belgium. And since there have been more than 100 live births, and already in 2018, there were 87 live births that stemmed from this technique. Pre-implantation genetic testing the evidence is developing. As I said, there is selective evidence about certain groups of patients where it is got good evidence of benefit based on retrospective data, non-superiority trials, some RCTs suggesting that it is increasingly safe and effective, and more effective in advanced maternal age at the moment, 35, 36 plus, where it seems to reduce time to first pregnancy and pregnancy rate per cycle, however, not influencing cumulative pregnancy rate at the moment. It does reduce potentially the risk of miscarriages if we manage to identify and hold back the transfer of abnormal or aneuploid embryos. It has its limitations, of course. It remains an invasive technique. And if we have indeterminate outcomes after testing or mosaics, we have a dilemma and are not sure which way to go at the time. There has been, therefore, an increase because it's an invasive technique and biopsying the embryos. Instead, there has been a move towards trophectoderm biopsy and watch the space of artificial intelligence. The artificial intelligence-based platforms which have the increasing ability to identify normal and abnormal embryos. For example, Erica, which is a platform that uses AI to identify by taking images to identify the abnormal or normal embryos, claim to have already achieved a positive predictive value of 80% to identify aneuploidy. Now, this all comes back to the practices of ART Fertility Clinics, and that is related, and I'll tell you why. Because the ethos, the signature and the DNA of ART Fertility Clinics treatment plans is to individualize treatment plans. And we know that as much as no two people look alike in the world, apart from the movies, there is no two people who have the same biology. Therefore, putting people in boxes and batching is never going to lead to ideal success rate, and we're not able to give these people their best opportunity to have successful treatment. So individualization and personalization of treatments is the signature of ART Fertility Clinics, led by our own proprietary research, which I again mentioned, led by our Group Medical Director, Professor Himant Fatemi, and his team. The spine of ART Fertility Clinics lies in research and evidence-based medicine, and patients are always central to our treatments. There's a patient-first focus, And we, without doubt, know that an educated patient is an empowered patient, and an educated and empowered patient who's involved in their treatment is a safe and more satisfied patient, eventually with higher success rate. And our success rates are amongst the best in the class globally. And our practices are all based in high ethics and transparency. All the treatment, the protocols are open to patients, and everything that ART Fertility Clinics includes in its treatment plans is transparent to our patients and to external audit. And I end my talk with this, and I hope this has been a useful introduction to the interesting journey that Patrick Stepton and Bob Edwards had, and a brief idea of what has happened since IVF has, since Louise Brown, the way IVF has developed. And that takes me to bringing on Louise Brown, our esteemed guest here, who's taken time to join us, join ART Fertility Clinics. I have said a number of things, and Louise to us and to the world represents that remarkable, that moment when it all became a reality. She gives hope to millions of couples around the world and individuals that it is possible. I pass you on to Louise Brown. Hi, Louise. Thanks for being with us.
Thank you for having me. It's an absolute pleasure to become an ambassador for ART Clinics in India. I feel it is a really important for me to help remove the stigma for patients needing to use medical help to achieve their families. Being the first IVF baby of the world, I believe it is my role to share my experiences as the only surviving person from my inception. I feel it is important to put patients' welfare medically, psychologically and physically first. I know my mum and dad, Bob, Patrick and Jean, would be so proud that their work lives on through me, and I am detrimental to carry on this work with passion as an ambassador for ART Clinics.
Shireen, I think your mic might be.
Right.
Yeah.
So thank you, Dr. Gurpreet and Louise. Now the session is open for any questions.
Shireen, I'll if I'm allowed to ask
Yes,
a question
from
Louise.
Yes, please do.
Hi, Louise. As I said, it's my pleasure to have you around, and it's a pleasure of ART Fertility Clinics to have you around, and it's a pleasure of audience in India to have you around as our brand ambassador, giving hope to millions of people and couples around in India and the world. And I'm sure if you do represent the development in IVF and this remarkable success, and you've attended these kind of events regularly. And I've sometimes wondered if someone was to ask you, what is the main message you'd like to give to people seeking fertility? What would you like to say as the most important thing that comes from your heart for these people?
If my mum can do it, anybody can do it. My mum was a very shy and quiet lady, and I just can't sort of put into words what she went through to have me. She just wanted a baby. She didn't care about anything else. She just went for the unknown. And my mum always believed she would be pregnant, and that Bob and Patrick and Jean would do that for her. And my mum's message, the same as mine, really. Keep believing, keep praying, keep hoping, and just believe that it will happen. And then fingers crossed it will.
Thank you very much. Shireen, if you have any question, do stop me, because I can, it's an opportunity for me to have a little chat with Louise here. So thank you for that, Louise. It's great. Yes. So, you know, it's amazing the courage your mom showed at the time. You know, imagine the time it was 40 years ago. All that opposition from the world. People felt that these guys, Patrick Steptoe and Bob Edwards, are behaving like God and interfering and encroaching on God's space, and who can accept that? And the Pope and the bishops and everybody was against them. All religious leaders were against them, and I think same kind of opposition was felt by most scientists worldwide. And as I said, it's an amazing story of courage and bravery by your mother, and as much as by the pioneers, as we talked about. And I'm sure you will agree with me in saying that things have since changed quite a bit, and it is a lot more acceptable, accessible, safe treatment, and therefore most people, in fact everybody, at least should be able to explore the idea if they wish to, should get in touch with an IVF clinic and should have a chat. Is there anything you would say still keeps people away from coming to IVF, in your opinion?
I mean, the different countries around the world I visited, a lot of it is the male fertility. I think a lot of men don't like to accept it, and there's nothing to be ashamed of. Unfortunately, it is a medical issue and it is part of life, and people just need, like I said before, the stigma, it just needs to be detached, and people need, if they have got a problem, they need to seek advice, and the sooner the better, because obviously as you get older, the chances decrease. So yeah, as soon as you realize you have a problem, you need to go and see a doctor. Touch with,
yeah, absolutely.
Yeah.
Absolutely. So the stigma keeps people away, and certainly men have a habit of being shy about accepting that there is a problem, while this is no different to any other medical condition. It is absolutely extremely common these days, as you said, and there are ways of dealing with it. As I said, there are treatments that have changed the face of male reproductive treatments. Shireen, I saw there was a question coming up. I'll hand it back over to you. Sorry.
So Louise, there's a question for you from one of our attendees. They want to know, did you feel any different in your childhood as compared to any other children?
No, I felt exactly the same as all my friends. The only difference was I had the press interest, but to me that was my normal. So no, I just felt the same as all my friends growing up.
Okay, that's great. So there are birthday wishes pouring in for you, Louise. Advance happy birthday wishes. There are a lot of people messaging you advance happy birthday wishes too.
There are many advantages of doing virtual meetings. One big disadvantage is there won't be a cake to celebrate your birthday today. I'm sorry.
I know.
We could have got a cake if we were in person. But that's what we miss out on with virtual meetings. But
there will be a time and place.
There will be one, yes. Yes, sure. And
so sir, do you have anything more to ask? So all right, so I think we can conclude this webinar right now. On behalf of Team ART Fertility Clinics India, I thank each and everyone who's been part of this webinar. Thank you so much, Louise, for taking out time, and thank you, Dr. Gurpreet.
Thank you.
Stay safe, and thank you, everyone. Take care.
Thank you. Bye.
Bye-bye.
Bye-bye.